For my clinical rotation, I was at a skilled nursing facility, and the patient I'll be talking about today is a female in her early 70s. She presented to my facility from the hospital after a fall and showed decreased safety awareness and unsteadiness on her feet. She is diagnosed with advanced Parkinson's disease and dementia. I got to do her initial evaluation and saw her 5 times a week, typically. What made her case complex to manage was her significant cognitive impairments. Also, her lack of safety awareness added to the complexity of her case because she required constant supervision. There would be times when we were supposed to be on a rest break, and she would try to stand up from her wheelchair and walk away when it was unsafe for her to do so. She really challenged my clinical reasoning because I would have a plan going into the session and typically needed to completely reroute depending on her attention level and also her emotional state that day. Her main goal for therapy in our setting was to be able to ambulate using her rolling walker at a household level so she could get back home. And I would typically start my interventions out with a few reps of sit to stands at a railing. I would incorporate some weight shifts and some mini marches to kind of get a feel for if I felt safe gait training with her that day. Some days she did really well. Other days it was clear that she needed a totally different route for the day. And that's mainly due to her safety awareness and, just kind of how she's responding to instructions, commands, things like that. She had a really difficult time initiating tasks, so I would, when gait training was appropriate for the day, I would initiate the movement of her rolling walker. At first, she required that constant initiation and constant movement from me of her walker, or else she would just stop walking. I felt that she did pretty well with repetition and direct commands for instructions. Too much talking and she would just lose attention and not respond well. So typically we would do multiple short walks. She began to progress to only requiring that initial initiation of the walker, and then she would continue to push the walker herself. Reflecting on this intervention, while it's definitely simple, I felt like that it was relevant and pretty high priority for this particular patient. She's someone who will most likely require 24/7 assistance / supervision in her home. But it was really cool to see her progress to having that increased independence with her functional tasks, just doing what she is able to do. On the day of her evaluation, she required max assist for transferring out of bed into her wheelchair. After a few weeks of working with her, and really learning how to communicate with her, that was the biggest barrier at first. I do think that she may have been able to do more on that first day. It was just more of a finding that communication style that worked best with her, tactile cues and different things. She was able to walk using her rolling walker up to 100 feet with contact guard assist. She really challenged me every session, but she really allowed me to grow, and I really enjoyed working with her.